Well, Dr. O, as you know, we did not have the opportunity to do our triple negative breast cancer broadcast this year, but we definitely wanted to check in with you and get the latest on research and trials here at Baylor, Scott, and White down here at Sammons Cancer Center. So what's the latest you guys have going on?
Well, there's a lot of trials going on right now here and around the country and world. Basically, the goal right now is to try to get rid of chemotherapy and substitute these protein antibodies that are mixed together, actually attached to super powerful chemotherapy drugs. And then that construct, that combination of the protein and the chemo goes right to the tumor cell, because the protein is actually targeted to the tumor cell to bind to a protein on the surface of the tumor cell. And those are called antibody drug conjugates. And there's a number of trials going on preoperatively, in the curative setting for stage 2-3 patients before they go to surgery. Instead of getting regular chemo and then the pembrolizumab, the Keytruda, they get one of these antibody drug conjugates and the immune therapy, the Keytruda, and then they go to surgery. Some of the trials, they get some of that, then they go on to some regular chemo and Keytruda, then they go to surgery. But we're hoping that that's going to make an additional benefit for people, that it'll be better than the chemo and work with the immune therapy better.
Wow. And is that also an infusion type of thing? So it's given the same way? And are there other side effects of this as well?
Yes, less than chemo. Unfortunately, there still is some hair loss, and there's nausea, easy to prevent. Some tiredness, but much less in regard to lowering of the immune system, which is great. Still some fatigue, but less than with the chemotherapy. The treatments are given once every 3 weeks, which is better than chemo, which oftentimes is weekly or every 2 weeks. And it doesn't cause neuropathy. No neuropathy, which is a biggie, as you know. No cardiac issues, no even possibility of leukemia. So, yeah, the safety profile is definitely better. And we're hoping, of course, that the cure rate will be better. That's the main thing. And then for patients who receive the standard therapy, which is chemo plus the Keytruda preoperatively, and then they go to surgery and they have remaining cancer, so it's not all gone yet. There's trials going on to bring these into that setting as well for gals who are still at risk for recurrence because the cancer was not all gone, to bring these antibody drug conjugates into that space as well. So right in the beginning and then also after surgery. So we're all hopeful that that's going to make the next step up, on the cure rate and that's the most important thing, is to be in the curative setting. But all of these agents start their initial trials in the metastatic setting. You got to get the initial safety and the right dose, and you got to get the signal that this is really very effective before you can bring it into obviously curable ladies, okay? But so there's a lot going on, really.
That is so awesome. I love the thought of no more chemotherapy. Are you kidding me? That's crazy. That's really cool. And to have less, side effects, and that's all so fantastic. I know one of the things that we also always talk about is how you can reduce your risk of breast cancer, and we've been talking a lot about weight loss. Can you speak a little bit more about that?
Yes. With regard to preventing breast cancer in the first place, and I'll say that we don't know a lot yet about preventing estrogen receptor positive breast cancer versus estrogen receptor negative breast cancer, triple negative versus the estrogen fed variety. We're not there yet to differentiate those two. But for example, there's some studies out now that have shown with the newer weight loss drugs, the GLP-1 receptor agonists, the Wegovy's and the Zepbounds of the world that are really given under the skin weekly, and people lose a great deal of weight. There's some population-based evidence that there's less cancers right across the board with substantial weight loss. And breast cancer being one of them. One of the studies had shown that there was decrease in the risk of a whole ton of cancers, but not breast cancer. That was weird. But then the subsequent studies did show reduction in the breast cancer risk as well. So I think the truth is, we know for sure that avoiding particularly postmenopausal weight gain in the first place, and weight gain is defined as more than 10% of body weight gain. It doesn't mean a few pounds, but it means 20, 30 pounds. Trying to avoid that in the first place in the postmenopausal years is important. alcohol. Alcohol, unfortunately, raises up the risk, not just a little bit. I mean, a couple a week is fine, but, even one a day does increase the risk a little bit, and two a day certainly increases the risk. So modest on the alcohol if people do drink. We know that very prolonged use of hormones after the menopause or prolonged use of hormonal contraception increases the risk of breast cancer a bit, not hugely, but, hey, if you do it for 20, 30 years, it will increase the risk. We do know that physical activity does lower the risk of breast cancer. That's really, and the rule of thumb there is about 2.5, 3 hours a week of just moderate paced, cardiovascular exercise. And there was a study done looking at a low-fat diet in the Women's Health Initiative. The Women's Health Initiative, a low-fat diet, and it didn't actually prevent the cancer, but what was interesting is in the women who got breast cancers, if they'd been on that low-fat diet, the prognosis was way better. It's kind of like the health you have coming into that breast cancer does matter. There have been other studies, and again, these are retrospective, so they're not as good as a randomized trial, but there's one study that showed that women diagnosed with serious breast cancer, stage 2 or 3 breast cancer, that if they came in and their blood level of vitamin D was low, they didn't do as well as if they had normal vitamin D levels. Now, again, that's not the highest level of evidence, but I think vitamin D is a very good thing. I think taking 1,000 IU a day of vitamin D3 and the soft gel is, I think, a very prudent thing. It's hard to get enough. We don't get enough sun. And as we get older, our skin doesn't make as much vitamin D as when we were younger. So those are the main things we really know that can reduce the risk. I will say lactation nursing reduces the risk of premenopausal breast cancer. Unfortunately, it doesn't carry over into the postmenopausal years, but it does reduce the risk of premenopausal breast cancer.
Well, it's like a catch-22 because it's like when you hit menopause, your metabolism changes and everybody gains weight after menopause. It's like, what's the trick? Just to stay active, really, right?
And it's probably diet. Whenever we're talking about maintaining weight or losing weight, it's always diet more important in terms of the impact. Exercise is critically important because it all works together. If we're exercising, the metabolism's better. The more muscle we have, the more the metabolism's better. But it really comes down to eating less of the processed foods. It's eating plant-based foods, higher protein, higher fiber, less in the way of the refined processed foods. And if we're going to eat grains, we eat whole grains. Now, I don't mean, of course, 100%, but that's what we have to focus on is less of the stuff that's kind of bad for us anyway. I think people really are serious. There's all these online apps that help you easily track your caloric needs and your caloric intake and your steps and stuff. So there definitely are tools, but rule of thumb is more protein and fiber.
Yep. I'm going to ask you one more question because you brought up the vitamin D, and I know when I got done with my therapy and everything, you had me just stay on vitamin D, and I'm taking lots of vitamin D right now. Is that kind of a standard when somebody finishes their breast cancer treatment?
It's not standard in the sense that there have been trials that say, hey, if you do this, your outcome's going to be better. There's not trials there, but a lot of people are deficient, and I think that we need D. I think D is really important for the immune system. For example, our overall well-being, how we feel, not only our bones but our muscles. Everything. I think D is very important. I wouldn't take a whole ton of it. Me, when it comes, but 1 or 2,000 a day. Now, some people need 5,000, particularly obese ladies need, because there isn't as much in their bloodstream. It may be in the adipose tissue, so they may need 5,000 a day, but it's an easy thing to check. Get enough calcium in your diet as well, either through dairy. If you're a dairy person, that's all you need. If you're not a dairy person, one of the Citrical Ds, either 500 or 600 milligrams, one a day with food, will help you absorb calcium and build bone for you.
Got you. Awesome. Well, everybody, give it up for Dr. O. They're going to make some noise here. Go. Thanks again, Dr. Joyce O'Shaughnessy here at Baylor Scott and White Sammons Cancer Center, downtown Dallas, doing all the research and trials. Keep rocking.